Let's talk about the prostate. Foods to eat in order to shrink your prostate, how to prevent BPH, benign prostate hyperplasia or enlarged prostate, how to prevent this, and then how to live with this. Now please listen attentively. Now, what is the prostate? The prostate is a walnut sized gland in men. It is part of the reproductive system. Yes, so during sexual intercourse the prostate produces semen. Okay, that's the whole process. That semen produced by the prostate is what carries this sperm during ejaculation. Now, the prostate below is located below the bladder in men, then surrounds the the tube that carries the urine to the bladder. Now, an enlarged prostate, remember, is invading around that your bladder, urethra, that tube. So if your the prostate becomes enlarged, that's where the problem starts. If it becomes enlarged, it now put pressure on the urethra, okay, making the person to start peeing all of the time. That is if you're lucky. If you're not, you can't even pass urine. It now starts, because of the pressure, either the urine starts packing up in your bladder or there is backflow of urine, okay, and this is painful. This can cause several other things, kidney infection and a lot of things. And this can now make you pee a lot of times, like any little thing you've pee, any little things you've. In a nutshell, what are the symptoms that you're having BPH, okay, or your prostate gland is enlarged, or you're having prostate issues? Number one, frequency in urination. Number two, your urine breaks. Number three, frequency in urination, like in the night, you find out that you're urinating like 6 times before the day breaks, and as you're going back, you're coming back, and then your urine stream is breaking, and then you're having abdominal, pelvic pain, and then your urine dribbles, okay, and inadequate to finish your urine stream. And then weak urine stream means that the speed by which your urine forces, like I remember when I was much younger, my siblings, the boys, my cousins, they would be peeing, and then they would be looking at whose urine travels far. Yeah, something like that. You find out that your urine maybe used to be like this and now it's now like this. It's just, yeah, it's part of it. It's part of the symptom. And of course, inability to finish your urine. Like, you, after peeing, you still feel that there is still urine in your bladder. You're still pressed because the prostate gland is enlarged and is pressing on the urethra, and the bladder can't fully empty. So BPH has become so common now that 50 to 70% of men are having it from 50 to 60 years of age, and about 90% of adults that are more than 80 years, 70 years are having BPH. So now let's get to what are the causes of BPH. Now, in the causes of prostate, this enlarged prostate, if you're coming from my Instagram, this will make more sense because some of the videos I post on Instagram, TikTok are very short, so I don't explain elaborately. Now, the hormone that controls the prostate is testosterone. Okay, now this testosterone also have another hormone called dihydrotestosterone. There are other hormones as well. So because the testosterone converts produces another hormone called DHT, that's dihydrotestosterone. High level of DHT causes the prostate to enlarge. Okay, so now this is why you must have heard that you should have a lot of sexual intercourse so that you can remove your sperm and all, so that your prostate does not enlarge. This is not the only cause by which the prostate can enlarge, not just because of there is a lot of sperm there. Okay, there are some certain foods that can make your prostate enlarge. Now, these foods, they increase the level of testosterone and inflame your prostate gland. So in this video also, I'm going to tell you the foods to avoid, like I said earlier, to avoid progesterone, to avoid prostate enlargement. Number one food that can enlarge your prostate gland is meat. red meat, especially consuming high level of red meat can affect and enlarge your prostate. This is because red meat contains high level of arachidonic acid, which causes inflammation. It triggers inflammation that affects BPH. It can even make you, if you're already having enlarged prostate, then you start having the symptoms. So please, if you have benign prostate hyperplasia, or they said your prostate is enlarged, limiting or avoiding red meat is number one way to go. I know your next question now will be, if I can't eat red meat, how do I get my protein? What are the alternatives? The alternatives are so many. If avoiding red meat, you can eat food that are high in omega-3, which is very good for your prostate health. Fish, which example, mackerel, salmon, just your fish. Those omega-3 are also good. The omega-3 fatty fish are also good in protecting your prostate. Another food you need to avoid if you have prostate issues, or you want to avoid enlarged prostate, is sugar. Highly refined sugar found in bread, donut, cake, biscuits. Highly refined sugar. This can trigger inflammation, and this can, cause enlarged prostate for you, mimic that excess testosterone and cause prostate for you. And if you're already having prostate symptoms, it can mask the symptoms and makes them worse. So it can also cause insulin sensitivity for you, and your sugar level will spike up. So this is something you need to avoid. Now, you can also find these sugary things in drinks, fizzy drinks, beverages, okay? Highly processed food, okay, like already made sauces, like ketchup and all of those things. They have lots of sugar in them that makes them, palatable to your taste bud. So please avoid these things. You can eat nuts in place. You can eat, like I've mentioned, I will be mentioning in the later end of part of this video on the food that you can eat to help you shrink your prostate. You can take some nuts, flaxseed, pumpkin seeds, these nuts, almond nuts. These are good. They are rich in fatty omega-3 acid, the good kind of fat, and they will also protect your health. If you consume a lot of sugar, processed sugar, it will keep giving pressure to your prostate, even though you don't have prostate issues yet. It's just a matter of time. The next food on the list that you can avoid if you have enlarged prostate already is caffeine. Caffeine, right? Caffeine, is a diuretic, so it makes you pee. And yes, it makes you pee. Apart from that, caffeine has a compound called xanthanic acid, and this irritates the bladder. So if you now take coffee, maybe in the evening when you're about to sleep, you find out that you pee a lot at night, and this can irritate your bladder, making you to all constantly pee because you're already having urinary symptoms, okay? And caffeine is doesn't, you don't just get it by taking coffee. Taking these beverages, drinks, energy drink, they have lots of coffee in them. So if you are already having a large prostate, please, caffeine is one thing you need to avoid. So, but that doesn't mean you cannot take your green tea. Please, green tea is a much better option because it's filled with a lot of antioxidants, okay? Green tea, chamomile tea, they are all good because you still find a little bit of caffeine in them, but they are just almost like insignificant. The next food you need to avoid if you have BPH or you want to prevent BPH, even if you don't have, is alcohol. Alcohol relaxes the muscles. This muscle relaxation, it relaxes the muscle of your urinary tract, and when your urinary tracts are relaxed, it makes you to pee frequently. So please, you have to stop alcohol, okay? It's not recommended. The next thing that alcohol does is that it enhances the process of inflammation in your system, okay? And inflammation already is going on in your prostate for those that are now having enlarged prostate, and this can cause more serious symptoms for you. So please, if you're already having BPH, you shouldn't be taking alcohol. If you want to prevent BPH, alcohol is one thing you need to run away from or reduce to the nearest minimum. Finally, before I forget, the next food you need to avoid is before the next food, Alcohol also makes you pee because it's a diuretic, okay? So it increases your urinary symptoms as well. So please, if you can, avoid alcohol. The next food on the list is dairy products. Dairy has a lot of calories, and the saturated fat content in it can aggravate BPH symptoms. That's the enlarged prostate. Now, dairy, I will explain what dairy are like cheese, milk, all your milk content, okay? Dairy products can enhance inflammation process in your system. Why? Because most of these dairy are made up with contains a lot of growth hormones. These farmers, they put a lot of growth hormones in them to make them to either produce a lot of milk or grow faster, so that they can start producing milk and a lot of meat. So because of these growth hormones, it can trigger inflammation in your body, and also because you're already having inflammation going on in your prostate. This is not a good thing. Some of the hormones, growth hormones in dairy products injected in this cow, for example, IGF, prolactin, can irritate the already inflamed bladder, the already inflamed prostate gland. So over time, even if you don't have BPH, your prostate is not enlarged, over time this can cause enlarged prostate for you. So dairy products. So I know now that you also be asking questions that, okay, since you're asking us to stop dairy or reduce our dairy products because of the risk of enlarged prostate, or for those that are already having prostate, to avoid it, what we do now, take, because of course you need the calcium. You can replace your normal milk with almond milk, okay, coconut milk, soy milk, and some other food that are not dairy. I've explained to us how you can find dairy, your milk products, cheese, even some butters, some of these things, your yogurt. Some of these things are, if you can take Greek yogurt in place, but a little, kind of. So the next food on the list is highly salted food, sodium. Okay, highly salted food and highly MSG food. That's monoglutamate sulfates. Forgotten the So MSG simply means in Nigeria you say cubes, taste cubes. What are these? Seasoning cubes, I beg your pardon. Okay, these seasoning cubes has a lot of MSG in them that makes it palatable to your mouth. Some of them have sodium in them. Sodium rich food that are highly sodium salted, also causes inflammation. It can draw up water in your body and make you pee a lot. Okay, and sometimes you may not even have control over it. So you need to really reduce your sodium intake, avoid highly salted foods and food that are high in MSG. This is why you should produce your food by yourself, make your food by yourself, because some of these food that are made in restaurants, it may not taste salty, but it's tasting real good in your mouth, and that's because there is MSG. These cooking cubes, condiments, in sachet form, most of them have a lot of MSGs, and they are not good for you. Remember, some of these sodium foods can be found in MSG food, can also be found in processed food. So please be aware of this. To make your food taste more palatable, you can use herbs like ginger, garlic, rosemary, and all. Then another food on the list, which is like the last, is spicy foods. Yeah, high spicy foods. Spicy foods which food that are high in pepper, chili. It can irritate your bladder just as what caffeine does, and make you have much urinary symptoms, make you urinate, and even reduce the urgency, increase the urgency. Having said about this, let's now talk about food that can help you shrink your prostate gland or enlarge prostate. Number one we'll have on the list is pumpkin seeds. I've always been mentioning this pumpkin seed. Pumpkin seed is very, very potent in reducing enlarged prostate. You have no idea how pumpkin seeds can enlarge prostate. I've seen it happen a lot of times. First of all, why? This is because pumpkin has a lot of zinc in it, a lot of vitamin E in it, and even the fatty omega acids that I mentioned, and some phytosteroids. These can, greatly reduce the postrate's enlarged prostate, and this in turn balanced your hormones. Number two food on the list is vitamin C. Another food on the list is vitamin C. Vitamin C helps a lot in reducing enlarged prostate. Vitamin C can be found in your bell peppers, red bell peppers, green bell peppers, yellow bell peppers. You can stir fry this and eat. And then with olive oil as well, because olive oil is also high in omega-3 and helps prevent inflammation in your general body as well as your prostate. Now, vitamin C, you can also see vitamin C in broccoli, kale, your cruciferous vegetables every day. Another food that is also very good is tomatoes. Tomatoes is rich in lycopene, and lycopene almost does the same things as the drugs they give you when you have BPH. It's very potent. Lycopene helps reduce your prostate size, enlargement. Lycopene helps balance the testosterone hormones and DHT. So lycopene is found in tomatoes, and you should, tomatoes, whether it is raw, but to get more of this lycopene, you should stir fry it, use it to make your sauces or anything, and use omega-3, use olive oil. The next thing on the list is omega-3 oil. Okay, this you can get it in supplement form, you can get it in however form you wish. This reduces the bad kind of fat and prevent obesity alongside with you working out. So get omega-3 supplements or eat food that are high in omega-3. So if, like I said, if you don't take this lot of fish all of the time, you can get it in your omega-3 supplement or flaxseed, naturally flaxseed, chia seeds, walnuts. These are nuts that are rich in omega-3. Now start consuming salads that are rich in cruciferous vegetables, okay, like onions, tomatoes, cabbage, broccoli, and all. You can boil your broccoli a little bit, and then please, if you're smoking, you have to quit your smoking or plan on quitting. Start cutting back from then you quit. Then your alcohol, stop alcohol intake and start working out, start doing exercises. The next thing is zinc. The prostate requires a lot of zinc components. It's made up of so much zinc percentage. So most of the times people that are having BPH are low in zinc. So if you want to prevent it, enlarged prostate, make sure you consume zinc-rich food, or you can get your doctor to prescribe zinc supplement for you. Remember that this video does not substitute, like I mentioned earlier, does not substitute to any medical advice your doctor is giving you, any medical treatment. Please continue your treatment. These videos are just to help you prevent and help other means that your doctors are telling you to do work better. If this is your first time here, my name is Nurse Merit. I'm a nephrology nurse. Basically, dialysis, kidney is my specialty. If you want to have a consultation with me or a urologist or any doctor, chat the number on the screen, and make sure you like this video and subscribe. Have a nice day.